Coughing uses loads and loads of energy, and it can sometimes feel like we're coughing up something that's not ready to come yet. So we want to try and use our breathing techniques to maximise our efficiency, so we're not wasting too much energy. Sometimes the particles that are aggravating our lungs, those little bits of secretions, that phlegm, is in the deeper part of our lung, and by doing our relaxed breathing exercises for 5 minutes beforehand, we take the phlegm and we move it bit by bit by bit by bit with each breath into these central channels, which are much easier to cough up and out from. So there are loads of different ways to support a cough. My favourite thing is a towel. So you can use a towel to go over weak muscles. If you have a diastasis in your tummy muscles, you've got a split in here from pregnancy, maybe a surgical scar, or you've torn a muscle, you can put the pad out the pillow or the towel, put it over that area and put pressure over it while you're coughing. That works in a similar way with your pelvic floor. If you make a sausage out of that towel, sit on it so that it's got something to brace against your pelvic floor as you're bearing down with your coughing. If you have back pain, you can make that towel longer, fold it along the long edge, wrap it around the level of your spine that needs a bit of support, or even around your chest if you're trying to give it a bit more support that way. Cross over your hands, and then you're pulling sort of around yourself to corset everything and give you a bit more stability whilst you cough. All right? There are other physiotherapy techniques. There's one called the FET, the forced expiratory technique, or a huff, where you're having a really long open-mouthed cough outwards. So it's a breath in and then an open-mouthed cough afterwards. It sounds a bit like this. Or something like saying k, k, k. That k sound closes and opens your epiglottis at the top of your throat in here with your vocal cords and might help trigger and move some of that air around in your lungs to help get the phlegm further out so that we're not coughing so hard and it doesn't take so much energy when we have to cough.